It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheatham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheatham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheatham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everybody, and welcome to another live show of Katz's Corner, and welcome to the first live show of Katz's Corner here on WABC. I'm your host today, Dr. Philippa Cheatham. Unfortunately, my co-host, Dr. Aaron Katz, is a sickly squirrel today. He's at home in bed and not feeling too well with all the winter bugs that are flying around. So I hope you feel better soon, Aaron. We have a great show for you today. I have a guest in the studio with me who's been on Katz's Corner before, Dr. Jonathan Haas from Winthrop, who's the cyberknife expert, the king of cyberknife at Winthrop. And I'm sure he'll be telling us a little bit about that. I also have a fantastic guest on the phone who is Jean Bruno, who is Dean of Academics and Professor of Dietary Supplement Science for Huntington College of Health Sciences. And we're going to be talking to Jean shortly about nutraceuticals that are good for your health, particularly for your prostate health, and also maybe talking a little bit about how we can incorporate some of those nutraceuticals into New Year's resolutions. Before we bring Jean on the show, I'd like to say good morning and Happy New Year to everybody who is listening to Katz's Corner, and also Happy New Year to you, John.
Good morning, Philippa. Thanks again for having me on today.
And thanks for rescuing me at the 11th hour with Dr. Katz at home. Hope you feel better, Aaron, and we'll be talking to Jean about some recommendations that hopefully will help you feel a little bit better. We also have our prostate health seminar that's coming up later in the year in June. And thank you to many of you who actually emailed in and called in to say that I gave out the wrong date. It's actually Saturday, June the 15th. I said it was the 16th, but it's Saturday, Father's Day weekend, and we'll be giving some more information out on that in future shows. So please save the date, Saturday, June the 15th. I've seen the programme. It's a fantastic programme on men's health. And I see, John, you'll be talking again. And I think you've seen the programme as well.
It was such a great meeting last year, too. I mean, I learned something. I learned a lot, actually. But, to have the chance to do this again, not only for the patients and the people in the community, but for the doctors. I mean, I learned heart health. I learned orthopedic health. I learned how to eat better. So, even if I wasn't speaking, I would go on my own. So I'm looking forward to doing it again.
Sure. And we talked a lot about prostate issues last year. And I see on the programme we're also going to be talking about integrative medicine as well with Gillian Capodici. And we're going to be talking about sleep disorders, which is also a show that will be coming up on Katz's Corner. And just remember, this show is for you. So if there's a particular subject on men's health or prostate health that you want Dr. Katz and I to cover, we're now into our third year of Katz's Corner. But if you want us to do a show on any particular subject, then give us a call on 1-800-848-WABC, and we will try and make sure that we put a show on a specific topic for you. Let's talk about New Year's resolutions, John.
So it's funny. I was out for dinner last night with friends, and I told you this before the air, and we were going, "What should your resolution be?" And my friend said, "Why don't you just go completely the other way? Why don't you just say my resolution is to eat less healthy and to put weight on? This way, when you do it in 2014, you can actually make it very easy for yourself." So my resolution this year, which is a real resolution, is to try to keep work at work and home at home, because doing what we do, it gets so all encompassing that my goal this year is to, when I leave the office, and we'll see if I could do that. It'll probably last about a week, but I'm going to try. How about you?
Does that mean you're going to leave your BlackBerry at Winthrop?
Right, my BlackBerry, my iPad, the CyberKnife can stay there because it's about 3 tons. But that's a reasonable goal this year.
Yeah, it's a good New Year's resolution, actually. In fact, when I was back in the UK over Christmas, I detached myself from the BlackBerry a little bit, and it helps, doesn't it?
It's addicting, though. I mean, I find it's almost too easy to stay connected in real time. And I can argue both ways. On one hand, sometimes it's easier to deal with the problems in real time. A patient calls, the nurses need you. But on the other hand, you need to have that separation of, almost like church and state to keep things apart.
Absolutely. Well, I'm banning BlackBerry at the dinner table. No
Deal.
Phones at the dinner table
Deal.
for 2013. Let's bring on Jean. Good morning, Jean.
Good morning, Philippa. How are you today?
Very well, thank you. So just to let the listeners know, you're Dean of Academics and Professor of Dietary Supplement Science for Huntington College. And I know that you have diplomas in nutrition as well as diplomas in herbal medicine and have written a number of books on complementary treatments. Before we get into talking about prostate health, do you have any recommendations for Dr. Katz and all those people out there who are suffering with winter viruses and flu and feeling under the weather, Gene?
Yeah, there's kind of two ways to go. One is when you start to feel that first twinge of, I'm getting a cold, the best possible thing you can do is be very aggressive with some dosing of the herb echinacea and good old vitamin C. The trick is to do it every couple of hours. And if you do that, what ends up happening is the cold virus just really doesn't stand much of a chance, and you knock it down before it gets hold. However, if it does get a hold of you, you still want to do a similar thing. And if you do that and you're aggressive with your dosing of those nutraceuticals, then you will have the cold for a much less a long period of time, and it won't be as severe. So instead of lasting, let's say, 7 to 10 days, you might be looking at maybe more like 3 days.
Okay, Gene, so let me just stop you there. So you're starting to feel unwell, and you're going off to buy vitamin C. Do you buy vitamin C tablets? Do you buy vitamin C drips? How much do you take? What dose?
Yeah, basically what you want to do is I'd get about a 500 milligram tablet or capsule of vitamin C. And I would take that, and for the first hour, I would take maybe, like say, 4 of those. And then after that, you use about 2 of them every other hour. And if you do that during your waking hours, it should really make quite a bit of difference.
And what about taking vitamin C anyway on a daily basis to prevent getting unwell in the winter months with all these bugs that are flying around?
I think it's a good idea, and I personally take about 500 milligrams myself daily. Some people take a lot more, but I think about 500 milligrams on a daily basis is a very good idea, and research seems to suggest that right around that amount the body can utilize. Okay,
and let's talk a little bit about echinacea. You mentioned the herb. Can you just spell that for the listeners, Gene?
Sure.
There you go. I've put him on the spot at 7 o'clock in the morning.
No, echinacea is ECHINACEA.
Okay, ECHINACEA. Tell us a bit about echinacea.
Echinacea is an herb that has an extensive history of use both in Europe and in the U.S. Has a very effective immune system stimulant, and and there's been a number of studies on it for helping to treat and prevent colds. And some studies you don't get as good as results, other studies you get much better results. And what I find in looking at the studies is, again, it's the amount that you use and how aggressive you are with it. If you use it correctly, you get a good result. And so I like to suggest there's different ways you can use it. You can use a liquid form. You can use a capsule form. If you're using a capsule form, I would tend to look for one that is standardized, so you're getting a standardization of what they call the echinacosides, which are one of the active components in there. Basically, if you're somewhere in the vicinity of 200 to 500 milligrams per capsule, you're doing good. If you're doing a liquid, it tends to be done a little bit differently. You look at the number of drops you're taking at a time, like 20 drops. And that's what you do. Similar thing. Start out with a dose at the beginning and do it every couple of hours, and it works very nicely. Okay, great. Well, thank you very much for that advice. I suspect when I go into the office this week, the office that I share with Dr. Katz will be full of echinacea and vitamin C deliveries coming in. John, do you take vitamin C? I actually take a multivitamin every day. Gene, what are your thoughts on that? Is that worthwhile doing? Oh, absolutely. I take one myself. I think it's one of the single most important things that people can do. In fact, in 2002, the Journal of the American Medical Association came out and recommended that virtually all adults take a multivitamin because we're not getting everything that we should be getting from our diet. Okay, it's 7:11 in the morning. It's 1-800-848-WABC. We're talking about nutraceuticals for
your health. And we have a great guest on the phone line with us. We've got Jean Bruno, who's Professor of Dietary Supplement Science at Huntington College of Health Sciences, who's an expert on nutrition and herbal medicine. So give us a call. We will take your call and we'll put it to Jean. So if you've got a question on any nutraceutical, you want advice, you want to improve your health in the new year, you want to talk about prostate health or sexual health, we're going to be talking to Jean shortly about some of these nutraceuticals. Jean, tell us a little bit about treatments for seasonal affective disorder. I know that many of us suffer with the winter blues, and the American Academy of Family Physicians states that 5% of people suffer from winter blues, but I think it's much, much higher than that. And so many of us feel down, depressed, tired, miserable in the winter months. What can we take for winter blues to help us feel a little bit perkier?
Yeah, there's a couple of things. One has to remember that when you're talking about something like seasonal affective disorder, one of the things that tends to be happening is these individuals will have a reduction in their serotonin levels. It has to do with the amount of sun that's out and then the amount of serotonin that gets converted into melatonin, a sleep hormone. In any case, these people tend to have lower levels of serotonin. And in some published clinical research, it was found that supplementation with an amino acid called L-tryptophan in the area of 1,000 to 2,000 milligrams daily.
L-tryptophan.
Yeah, that's a precursor to serotonin. Your body will take that and make serotonin out of it. And they had some significant relief of the symptoms associated with seasonal affective disorder when they did that. And so that is one of the things that a person can do. And the other thing is vitamin D. There is some data showing that vitamin D is very effective in mood, particularly where you're talking about some of the seasonal variations in that. And that makes some sense, too, because you get less sun in the winter. And so the amount of vitamin D that your body would make, because it doesn't have the exposure to sun, is lessened. And so that has had some good data, too. And I would look at both vitamin D, 2,000 units a day. I would look at L-tryptophan, 1 to 2,000 milligrams a day.
Well, I know that John Hass, who's sitting with me, is not only an expert on the cyberknife, but is also an expert on vitamin D supplementation. He's always running off to the sunshine, John.
Well, yeah, it's real funny because I just got back from Florida last week, and it's so true. In the middle of winter, or as the weather gets colder and darker, I just feel worse.
Oh, yeah, absolutely common.
Yeah, and then we were in Florida last week, and I came back, and partially it's
that's a suntan, is it?
Right, it is.
I thought it was dirt. I thought you just had a chance to have a shower.
Right, exactly. Early morning on Sunday, but I do feel better when you're out for a little bit, and you just feel healthier. And I don't know if it's partially just a placebo effect or if it's a real thing, but I definitely notice when your vitamin D goes up a little bit, you feel better.
Oh, it's not a placebo effect. I mean, you well know as somebody who has read a lot about vitamin D. 77% of Americans are vitamin D insufficient, and about 47 or somewhere in that vicinity are outright deficient in vitamin D. It's the most prevalent nutrient issue out there. So people are going to feel better when they get what they need.
Is it possible to over-supplement yourself? Can you take too many vitamins?
You can take too many of anything, too much water and you drown. But the thing about it is that there's certain nutrients you simply don't get enough of. Vitamin D, we just don't get enough of. And people are they're going to their doctors, they're having tests, and they're having to, sometimes they're having to take very high levels just to try to reach normal serum levels of vitamin D. So yes, you can get too much of anything, but vitamin D, it's unlikely you're going to get too much of, and most of your water-soluble vitamins like vitamin C and your B vitamins, if you don't utilize it, you just excrete it anyway. So you're not in much of a danger of getting dangerous levels for the most part.
I'd certainly agree with that, Jean. Although we do know with vitamin D being a fat-soluble vitamin that it is possible for people to become toxic if they take too much. I know that most people are deficient, but I think it is important that patients do have their levels measured. And certainly Dr. Katz and I measure patients' blood levels of vitamin D. And let's just talk a little bit about vitamin D and prostate health and testosterone, because I know that you know a little bit about that as well, Jean.
Sure. Well, we've discussed a little bit about vitamin D in general, and, it is it does have a role in so many areas of human health. The well-known role, of course, is its role in helping to promote calcium absorption and being important for the prevention of osteoporosis. But it does a lot of other things. Like, for example, vitamin D helps to inhibit uncontrolled proliferation of cells, such as found in cancer cells, and it helps to stimulate differentiation of cells, which cells for different functions. And it's a very potent immune system modulator. And so it has a number of very interesting roles from that standpoint. Now, what I found very interesting is there's studies on vitamin D where one interesting study where men who, not unusual, had reduced levels of vitamin D, which is very common, when these men were supplemented. And by the way, they also at the same time had lower levels of testosterone, also not uncommon as we age. Well, when they gave them about 3,300 milligrams of vitamin D daily, they found that not only did it bring their vitamin D up, but guess what? Their testosterone levels also increased closer into those normal ranges. So there was a real, significant difference. And so, I think that's a very interesting component, and you're seeing out there various nutraceutical products that purport to help support testosterone
and it's certainly, vitamin D is certainly something that a few years ago we heard very little about, but certainly last year there were big articles in the New York Times, the Wall Street Journal. Many of the medical journals were publishing on vitamin D, and Dr. Katz and I looked at vitamin D deficiency in the urological population. So I think measuring vitamin D levels is important, not just for your general health, prostate health, but also general protection against cancer. Thanks very much for that. If you're listening, please give us a call on 1-800-848-9222. That's 1-800-848-WABC. If you have a question about nutraceuticals related to general health or prostate health, or if you have a question about a PSA issue, if you want to talk to John Haas about the CyberKnife or any treatment for prostate cancer, do give us a call, and we'll try very hard to take your call before we finish on the show. Jean, let's just talk briefly about saw palmetto for prostate health. We have a lot of patients that take saw palmetto. Tell us a little bit about this.
All right. Saw palmetto is an herb that has been used extensively in the U.S. by Native Americans, in many generations past. There's been a lot of research done on saw palmetto as a sort of a fat-soluble product that you take in like a soft gel capsule, for example. And what they found, they used it on patients with BPH, benign prostatic hyperplasia, the swelling of the prostate gland that occurs tends to occur as we age, and can have a number of symptoms associated with it depending upon how it goes. And what they found was that in the use of saw palmetto, about 320 milligrams daily, that the men treated with it tended to have significant relief of some of the urologic symptoms associated with BPH. And in a couple of studies, they actually compared it to Proscar, which, of course, is a very common medication used for a similar purpose. And what they found was that the saw palmetto had very similar effects in reducing those same symptoms, improving, peak urine flow, improving the urinary tract symptom scores, and it was very, very effective. And they found that while in some cases Proscar might have some side effects such as erectile dysfunction, that the saw palmetto did not have those same effects.
John, do you use saw palmetto, or do you see patients on saw palmetto?
I personally don't. Like I said, I do take a multivitamin every day, and I see patients on saw palmetto. So for me, this is an education to learn a little bit more about it.
And the reason it tends to work is one of the things it does, it has a few mechanisms of action. One of them is it helps to inhibit the 5-alpha reductase enzyme, which converts testosterone into DHT, which is associated with BPH. So you're keeping more of your testosterone, converting less of it into DHT, which is desirable. Also, it inhibits certain inflammation factors in the body. Well, that's going to be good for this situation, and it even has an anti-estrogenic mode where it reduces the conversion of testosterone into estrogen.
There's certainly a lot of research that's been published in the urological literature on saw palmetto. I mean, I certainly find that some patients who take it do fantastically well on it and have a huge improvement in symptoms, and other patients have very little improvement. But the nice thing about these natural products is that they certainly generally don't have the side effects that can interfere with other medications. Usually there's very low interactions.
Jean, for people that are shopping, let's say you go to a health food store, you go to a vitamin store, how do you distinguish between what is a legitimate product?
Excellent question.
And what's not?
Yeah, and with saw palmetto, you have to use the right stuff or it won't work. And here's what you look for. You look for a saw palmetto that will say in the side panel, you'll see the supplement facts box, and it'll say saw palmetto, and then it'll say in parentheses 80 to 90% fatty acids. If it doesn't say 80 to 90% fatty acids, okay, you don't have the real deal. And furthermore, it needs to be either in a soft gel capsule or in what you call a liquid cap, which is like a little two-piece hard shell with a liquid inside. It can't be in a dry form. It can't be in a tablet. Okay, it can't be in a powdered capsule because that's not the real extract that's been studied. So use the correct stuff, 320 milligrams daily.
Okay, great. So we've talked about saw palmetto, Jean. Thank you very much for that information. And we've talked about vitamin D. Tell us a little bit about L-arginine and sexual health, because Dr. Katz and I certainly use that for patients. But give our listeners a little short summary about L-arginine.
Okay. L-arginine is an amino acid used by the body, and the body will use arginine. One of the things it uses it for is to create nitric oxide, a compound in your body that's important for circulation. And so literally, L-arginine is needed to create nitric oxide. And what happens is, if you have a reduction in nitric oxide levels, your circulation isn't as good, including circulation to the genital region. And a lot of the medications out there now that are helping with erectile dysfunction play a role in helping to release nitric oxide, and so that's one of the benefits. Well, if you take L-arginine as a supplement, it can actually help to improve your nitric oxide production. And there has been some studies done with L-arginine in men with erectile dysfunction, finding it to improve sexual activity and help to reduce a number of the symptoms associated with erectile dysfunction. And I love this because not only are they getting the benefits of a reduction in erectile dysfunction and improvements in sexual health, but they actually get overall benefits for circulation in the body. And the doses that have been used in the studies have ranged anywhere from 1,700 milligrams to up to 5,000 milligrams. And at the lower dose of 1,700, generally then that's been combined with something else called pycnogenol, which is a pine bark extract.
I mean, I was amazed to see how many different conditions L-arginine has been associated with treating: diabetes, heart failure, hypertension. Is this something that's easily available from health food shops?
You can go into just virtually any vitamin store or health food store, and you can find L-arginine. And so what I would suggest for men who want to try L-arginine is to use the minimum dose, if you're not using it with anything else, is somewhere around 2,800 milligrams. And you can do that. You can buy capsules that are like 500 milligrams, take close to that amount of the 2,800 milligrams, and you can do split doses. It's important to understand that what you don't want to do is say, oh, well, I'm planning to have sex tonight, so I'm going to use it. It's not like that. It's like you use it on a daily basis.
It's not a herbal Viagra.
Yeah, you increase it to a level that now you have a better nitric oxide level, so whenever you're ready, as opposed to, I need to take it because I'm planning to have sexual activity tonight.
Sure, and I've certainly used this to improve blood flow in patients who've had prostate cancer surgery. John?
Gina, are there any sites or websites that you might recommend for our listeners where they might want to look on nutraceuticals that you would say are valid sites to do some homework?
Sure. One of the websites that I really like is the Linus Pauling Institute Micronutrient Research, and that's actually under the Oregon State University's website. But the Linus Pauling Institute, if they look there, they can find a tremendous amount of...
How do you spell that, Gene? Linus, did you say?
Yeah, Linus Pauling, Pauling. Linus Pauling, of course, was a Nobel laureate, and this is...
So put that into Google and see what you come up with. Let's just talk briefly about zinc. I know we haven't got a huge amount of time left. Zinc and prostate health and sexual health.
Yeah, zinc, one of the things that men don't realize is that zinc is just vitally important for their health. You find high levels of zinc in the prostate and in the testes, and in fact, you also find it in seminal fluid. And when a man ejaculates, he actually loses zinc, so he really needs to replace that. And so it's important to get an adequate amount of zinc in the body. Zinc also has that benefit of inhibiting 5-alpha reductase, just kind of like saw palmetto does. So that has some benefits. They've been found to help improve testosterone levels and to reduce DHT to some extent.
What about foods that are rich in zinc? Can you eat those?
Sure, certainly you can. Of course, the common one that we often think of when we think of that is like oysters. Oysters are in fact a good source of that.
There you go. There's the science for oysters being an aphrodisiac, John.
Well, there you go. There is some truth to that. A lot of foods nowadays are, especially refined foods, are actually enriched with it. But oysters, crab, beef, pork, chicken, turkey, yogurt, cheese, milk, cashews, almonds, peanuts, baked beans, these are all reasonable sources of zinc.
John, thoughts?
No, I mean, for me, it's interesting to hear the science behind what we think is, almost like the myth.
Absolutely.
And you hear these stories about oysters being aphrodisiacs. You hear all these stories about different foods, but it's nice to hear almost on a cellular level, how it actually works.
Absolutely. If you eat 6 oysters, 6 medium oysters, you get about 76 milligrams of zinc.
Well, I wonder if someone will be coming into the office tomorrow asking for a prescription for oysters. What we'll say. What's your thoughts on selenium and prostate health, prostate cancer issues?
Yeah, selenium, there's some very good data on it. Studies have shown fairly consistency, epidemiological studies, that when men have lower intake of selenium, there is an inverse relationship showing increased risk of prostate cancer. Now, selenium is an antioxidant, so it helps to prevent oxidative damage to the cells caused by a variety of external and internal factors, free radicals, and the like. It also works very nicely synergistically with vitamin E for the antioxidant benefit.
So if we're going to be making a prostate healthy cocktail, we want to add saw palmetto, L-arginine for sexual health, zinc for prostate health, keep your vitamin D levels up, selenium, and maybe throw in some echinacea and vitamin C with some oysters as well. What a cocktail.
Indeed. Yes.
And DHEA, that's also something that a lot of patients ask about for aging and sexual health.
Yeah.
Gene, what's your thoughts on that?
DHEA is a hormone that gradually decreases as we age, and by the time you're like in your 70s, you'll have maybe you'll have 90% less of what you had when you were young, and it has many roles to play in your body. One of the things
well, Gene, there's the music. That's the end of Katz's Corner, and thank you for being such a fantastic guest. We'll definitely have you back on the show. Happy New Year to all our listeners. Feel better, Aaron, and this is Katz's Corner on WABC Live every Sunday. Give us a call next week and tell us what you'd like us to cover next week. Bye-bye.